In the past, many people were cared for in hospital and not at home. Recently, we really have tried to strengthen the programs that allow patients to be cared for at home by their loved ones and caregivers, but we didn't quite get the aspect of caring for the caregivers at the same time. So now we're just catching up and realizing how important caregiver health is, as well as the patient's health.
I'm Pauline Linton. I'm a registered nurse. I've been a registered nurse for 34 years, most of it here working at the Seaforth Community Hospital for the Huron Perth Healthcare Alliance. They feel very frustrated with having to repeat the same information. It's like a patchwork quilt. It's all about their one loved one, their one patient, their one person, but lots of times having different healthcare providers give them different facts. And trying to piece it all together.
Never thought of myself as being a caregiver, never, ever. Sometimes you wonder, does anybody see you? I'm tired. I am tired. I didn't know I was tired, but I am tired.
I think it's really important, number one, to reinforce best healthcare that we provide only happens when you work with your partners in the system. And through this Connecting the Dots initiative, we have 2 family health teams that we're working with, Star Family Health Team and North Perth Family Health Team. We're working with One Care, Home and Community Support Services, the Local Health Integration Network, and Alzheimer's of Perth. We recognize that if we really wanted to ensure that caregivers were understanding the system as well as they could and being able to connect in appropriately, that we all had to come to the table. We see a lot of different patients and clients, and because of that mix of skill sets and focus, we're really able to make sure this project touches on all the right points.
I'm Megan Ryan. I work at One Care. We actually set up clients for services, so whether that be Meals on Wheels or transportation or caregiver supports, we're kind of the hub for the intakes for Huron and Perth. I'm using the time to talk. I use my lanyard specifically, use the questions that are listed to ask the caregivers how they're feeling, get them talking, get them expressing, if they could use any help. So by asking them, how are you feeling? What if we set you up for meal program? Would that take some of the burden off you?
I think for me, it's made my practice much more rewarding. I definitely think it's opened the door for my caregiver patients to approach me and to seek help. It's really opened my eyes that a simple question given in a sincere manner can make a world of difference.
I feel lighter. I have gotten it out. I've said it. It just was freedom. Somebody listened to me. I felt there was a big burden lifted off of me.
It's really nice to have a resource to give them, something that speaks to self-care and speaks to their role and what they're doing. The staff are realizing that, everything about nursing isn't about saving a life, it might be changing a life. Almost every single patient has a caregiver. It's just looking at something a little bit differently.
By investing a few moments in the patient's appointment or encouraging the caregiver to have their own appointment with you to discuss how they're doing, there are so many benefits that make it really worth the time.